Hello, everyone. How are you guys? This is Taryn. I am the Managing Director for Future Building Nursing Prep Center. And guys, I'm here today with a very, very special video, which have been long awaited for. And our students have been sending us requests, and the outsider students as well have been sending us requests that please do a video on NGN. I know this is something which is scaring you guys, making you guys anxious because, whenever the exam is new, we always get panic about it. And so we are here. You know that FBNPC got your back. We are here for you guys, okay? So we are going to discuss with you guys every single thing. So I want you to be patient because we will be doing this video in multiple parts because there is a lot to tell you guys to relieve your anxiety so that you feel calm and comfortable when you're doing that exam. And make sure you have your paper and pen ready, and then we will go through NGN. So I will go through everything, guys. Like I will give you guys introduction, like what are the changes coming up. Then we will also be talking about the scoring system. We will be talking about all different type of questions you can expect in your exam. Plus, we will talk about the most scary thing, which is unfolding case study. So stay tuned, and I hope you enjoy this video and make sure you share it with your friends. So I'm putting this disclaimer. We are making this video for educational purposes. So that's why we want to say thank you to NCSBN for sharing the material. And we will be using that material to help you guys and navigate through this, like how this NCLEX NGN is going to be, which is NCLEX Next Generation. Okay. So I'm going to start with my PowerPoint presentation with you guys. And just bear with me for here. I hope you guys can see my screen. And we will be talking about NGN here. And this is a presentation by Future Building Nursing Prep Center. So let's just start first thing first show, okay? So let's just talk about directly what is changing, what is going to remain same. So I'm just gonna go through that. So you can clearly see in this table, if we look at the time was 5 hours in the previous NCLEX, and in the NGN, it's also 5 hours. And you guys know NGN is starting from 1st April 2023. Delivery method you can see is CAT. So it's computer adaptive testing. So computer adaptive testing, if you guys just don't know, I'm going to tell you in a nutshell, but I already have made a detailed video on, which is actually on our RexPN. You can find it on our channel, but I have explained everything over there. What is CAT and all these three rules, like, CI stands for basically what they're saying is the confidence interval rule, 95% confidence intervals rule. ROOT root stands for run out of time rule. And then we have maximum items where you get, full length. So I've explained all that, but CAT, moral of the story, my students, they already know that I love moral of the stories, okay? So because I feel like, guys, do you agree with me? We don't remember, if you think about our childhood also, we don't remember all the stories. What we remember is at the end, moral of the story. So moral of the story here is that when you are writing, this means is every student is getting their individual question and the exam build up right then and there. On the basis of how you are answering your questions, the computer will pick the next difficulty level of the question for you guys. For example, let's just say there is student Sam who did question number first correct in the exam. Now the computer is going to throw him the second question, which will be 50% harder than the first question, right? So let's just say Sam did that question too. Now, unfortunately, Sam did that question number 2 wrong because it was hard. So now the computer is going to throw the easier question, right? So this is how, in a nutshell, the CAT system works depending upon how you are performing. So of course, you want to perform at a little bit higher level, because if you just keep on answering the easy questions, your graph is going to be below that competency line, and which means that, you're not kind of passing your exam, right? So if you look at the maximum length here, that this is the difference here, guys. Sorry, I'm just going to go back here and I'm trying to use my fancy pens here to show you guys. The maximum length in the previous one, like this is going to stay up till 31st March, is 75 questions to 145 questions. But this is a big change here, you can see. Now you will have minimum questions in the NGN as 85 questions, and the maximum what you're going to do is 150 questions. Then we will talk more about NCJMM. What does that mean? And you can see that there are 3 or 18 items or 3 case studies you can expect in your exam. And I'll talk more about it. Then you can see remaining standalone items can be 60 to 130, 52 to 117. What does that mean? I will break it down for you guys in the next slide. So that's what I told you. I need patience. I need you to have your pen and paper ready and sit down with me to learn about this. And then total scored items is 60 to 130 and 70 to 135. And unscored items are 15. 15 means, guys, these are your like pre-test questions they give you. For example, let's just say they are testing the questions which they want to put after 2 years. They want to start testing those questions, right? So again, I'm going to give you moral of the story. Moral of the story is I tell my students, don't worry about this because you don't know which ones are 15 pre-test or research questions. So why do you have to worry about it? So just go with a simple basic rule that minimum you have to do how many questions in NGN? 85. And the maximum questions you have to do is 150. So that's what is your take home message. Okay. So next is, so this is something which I was telling you guys, I'm going to break it down for you guys and I'm going to explain you because we got lots of queries where people are confused. Students have been phoning us and they're saying, how many case studies in 150 questions? If I'm getting 150, let's just say if I'm doing maximum length rule, or if I'm doing run out of time, let's just say at 120 questions, how many questions are we getting? So this is, and how many new questions we are getting. So that's the question which we're getting from the students a lot. So I'm gonna, here is your answer for that. If you guys look at it, NGN, so there are 3 situations or scenarios which we have based for you guys. In the first scenarios, you would see that the student can get maximum 3 case studies in the exam. So this means, and you guys know each case study will have how many questions? 6 questions. And just to let you know, we call questions as item number when we talk about, in terms of educator language, So 6 questions in each case study. So 6 times 3 is 18. So you will have 18 questions. That's situation number 1. Situation number 2 is some students might only get 2 case studies and then 6 standalone cases, right? So this is where the students are getting like lots of confusion. So guys, when we say case study means unfolding case study where you will have back-to-back 6 questions related to one case. Then 6 standalone cases means you will have an individual case and there will be question associated with that. What type of question you can get, format of the question, I'll talk all about it in the detail. And this is the reason we are making this video, guys. What I personally felt like was I have seen like many videos on the YouTube but I felt there was something missing here. Something missing was there and there was like still the information was scattered for the student. So that's why we wanted to make this concise video. I know it's going to be long and it's going to be in the parts, but we wanted to be very, very clear and very, very precise with our students how it's going to work, right? Because you guys know FBNPCs, our goal is not just to help our students, but our goal is to help the students, nursing students worldwide. Just like, the video when we made for New York, oh my God, thousands of students got eligibility to get RN exam from New York free of cost. Free of cost in the way they didn't have to pay any single penny because we showed them how to fill form by form on the YouTube. So I'm pretty sure you guys have checked that video too. Anyhow, coming back, let's just say situation number 3, where you might only get 1 unfolding case study and then 12 standalone cases. So here is the next thing which I want to show you guys. Again, Taran talks about moral of the story. Moral of the story means students are panicking, but you are only going to get 18 questions which will be new from the new pattern. The rest of the exam is going to remain the same. So I hope that is reassuring for you guys because, I understand. And, change is always hard. That's a human nature. But again, look at it. If you're doing 150 questions, you guys can do your mathematics, bring your calculator. Out of 150, you might have only 18 new questions. Not might, you will get 18 questions new. And rest are all the same, which we used to do in the previous NCLEX. So win-win situation. I hope your anxiety is going to get relieved from that. So this is, I've already explained, minimum question 85, maximum is 150. And even if you're writing minimum length, which is 85 questions, you guys will still get 3 case studies, not 3 case studies, 18 new style questions. which can be case study or a standalone case study type of questions. Okay. Now let's just talk about the purpose of changing. This is what the students like. Taran, why do they have to change the exam? What's wrong with it, right? So guys, you need to understand that nursing is a dynamic profession, right? Things keep on changing every single day. We want our nurses to be efficient. We want our nurses to be capable enough, and we want them to look after and manage our clients' safety. So the test plan is reviewed and approved by the NCLEX examination committee every 3 years. And so now you guys would probably guessing when the next changes are going to come. You're correct. This is 2023. So the next changes will be coming in 2026. Okay. And they want to make sure that the nurses are capable enough to work in a complex environment and they can make those complex decision making. And that's why you would see that Taryn is not crazy. She's wearing the stethoscope today because this is what I'm going to explain to you, that new NGN through these case studies is trying to put you in a hospital scenario. That imagine you are in a hospital. So I want to get that feel of hospital, right? So imagine you're in a hospital, you're working with that particular type of client. What are your feelings going to be? How are you going to judge that client on a clinical scenario? All those things, right? So that's why they increase the complexity of the exam as well. So now what is this NCJMM? You saw that in the first slide or the second slide. So NCJMM stands for the NCSBN, which is the one which conducts the exam, Clinical Judgment Measurement Model. Okay, so they have designed these 18 items or the case studies on the basis of this NCJMM model. In this one, what you have to do is the nurse has to basically go through 6 steps, recognize the cues, analyze the cues, prioritize your hypothesis, generate solutions, take actions, and evaluate outcomes. So you're gonna be like, what is this? Can you make it like little easier for us? Absolutely, guys. I'm not sure if I'm making it easier or tough here, but here I'm gonna break it down for you guys. If you look at this is the actual model now on which they have based this exam. This is called as NCSBN Clinical Judgment Model. And now you can see it has 4 layers. And at the end, there is a nursing process. Okay. So I'm going to give you, let's just talk about a quick scenario here. Okay. Let's just say, Mr. Smith, you are a nurse who's working in the emergency department and you saw this elderly gentleman walking. He's hunched over, short of breath, and then he's walking to you and he's unable to speak. Like he's like this, right? So now, just by looking at the patient, as a nurse, we should immediately know what do you think is the client's need, right? Of course, ABC is your top priority in NCLEX. You guys know that. Then what do you do is you make a kind of a clinical judgment about that patient. You're anticipating in your mind, okay, maybe this is a scenario, this is a scenario. Then of course you do the assessment on your client. You collect your objective data or your subjective data, and then you make your hypothesis. This is the probability may be happening. Maybe he has shortness of breath because he has COPD, or maybe he has pneumonia, or maybe he has chest injury. So you're making all those kind of hypotheses in the mind. Then of course, you recognize the clinical sign and symptoms, you analyze the clues, then you prioritize. This is the biggest key in NCLEX. You guys should know that. Prioritization is the key and that's how lots of students, they don't pass their exam because they don't know how to clinically prioritize. And that's what we help you guys, to help you understand. Then as a nurse, you also have to generate solution in the mind. So for example, simple thing, somebody's coming with a shortness of breath. What's the first thing the nurse wants to do? Of course, you want to position the patient properly, maybe in a sitting position, orthopedic position, and then you want to put the oxygen on. Common sense, isn't it? Then you have to take actions and then you have to evaluate the outcome, right? Whatever the nurse did, for example, if I gave positioning and I give oxygen, then I have to also continuously monitor, did that even help my patient or my patient is deteriorating, right? Then in layer number 3, you can see we have different factors. Lots of things can contribute towards patient's condition. It can be environment, client's observation, resources, medical records. That's why in the case studies, you will see different tabs, client's notes, nurses' notes, records, vital signs, diagnostic testing. So basically, guys, what they're trying to do is This reminds me of the case when I used to take my students to clinical, because I have been registered nurse for 11 years, more than 11 years here in Canada now, and I have been working as nursing educator almost for kind of 7 to 8 years now, you can say that. And I used to take my students in the medical and surgical settings. And this is how exactly we used to work, when the students, they do the data collection, they work with the client, and then they figure out what their priorities are, right? Your client might need 10 things, but what do you want to do right now for your patient? Is that something what you're looking for? And then most of you will be familiar if you have written the NCLEX before, or if you have done the preparation is nursing process. And I know it sounds like and looks a little bit different, but I'm going to make your life simple. Most of the time, our students, they learn the things by, I'm going to change the color of my pen here, is we used to remember it by ADPI. So A stands for assessment, and now they have just replaced the word. So don't get confused. Diagnosing or analysis, right? So they're just they have just changed that word. P stands for planning, I stands for implementation, and E stands for evaluation. So basically this is the nursing process. And I'm pretty sure if you're watching my video, you're all nurses, or you're nursing grad students, or you have learned this process in the nursing school. It's not something which is rocket science or from planet Mars, right? So this is what we have all done in our nursing programs. So this is easy peasy, lemon squeezy, right? It's not too hard. So now that's what in the nutshell are the basic changes they have made. And time allowed is still, so what's not changed? Let's just talk about it. So time is still 5 hours, just repeating and summarizing. Delivery method is still CAT. And then you guys, I don't want anybody to fail, but just in case if somebody fails, you know how the students, when they fail NCLEX, they get the detailed report, and it tells you in which categories you have failed, in which categories you were near passing, above passing. So now what they will do is, when unfortunately if a student would fail, then they would also add those NCJMM steps as well, that where the student was lacking in the case study, right? So that's what they're also going to add. And this is what I laugh with the students. What never changes about is fear of NCLEX. Guys. Something which doesn't go with the NCLEX is fear and anxiety. I don't know how, but in CAT adaptive exams, computer is just so smart. If the student is anxious, student is panicking, student is depressed, I don't know, computer is going to sense it. Why? Because when you are doing all those things, your brain is not performing at a higher functioning capability. So that's why no fear of NCLEX. And if you want help, Team FBNPC is always here for you guys, okay? So now let's just talk about date. We have already done that from the beginning. April 1st is that golden buzzer date when this exam is changing. So students ask me this question, Taryn, what do you think? Is it personally going to become hard, or is this personally going to become a tough exam? What do you think personally about it as a teacher? So as a nursing educator, as a teacher, what I feel like is, guys, and I'm going to give you my honest opinion. If your nursing concepts are clear, you are thorough with your concepts, which means you should have a good knowledge about your nursing fundamentals, medical, surgical nursing, maternity, like basically all, modules of nursing. If you're clear with it, why wouldn't you pass this exam? Right? And the second I feel is kind of more easier, in my opinion. And why I'm saying this, I'll tell you at the end. Because if we talk about case studies, you would technically have one case study. I know it's a bigger one to read, so you would need a focus for sure, 100%. But then you would have 6 questions which are back to back, right? And then I think if you know the concept, you can be pretty sure that you have done those 6 questions correct. And the second thing, which I really loved in this exam, is partial marking grading system. So earlier, if you're writing old NCLEX, either you get marks or you get 0, right? If your answer is incorrect. But here we do have partial scoring. How the partial scoring works, we're going to talk about it in different part of the video, because it itself is a very long process, which I have to explain you guys. Third important and the easiest thing which I want to talk about this NCLEX is, guys, that you will be given lab values. Hip hip, hooray! I want you to say that, right? So earlier, like, the students, unfortunately, those who are writing before 1st April, they have to, like, a little bit memorize and keep the lab values in the mind. But here, what they are doing in these case studies is like, they are just like, how the nurse works in a real hospital setting. You have patients chart in front of you. You can see the lab values, and labs, they give you the reference, okay, this is high, this is low, this is what is happening. So just like they want to simulate the real environment, and that's why those lab values will be given. So if I have to navigate through pros and cons, I think this exam has lots of pros. Thing is, you guys just need a positive approach and a positivity in your mind when you are approaching this exam. Okay, so I'm going to share my screen back with you guys here. So next is, we will talk about in the next part of the video is all these different item types, right? So NCBSN has approved new item types. You knew in the previous exam, we used to have multiple choice questions, fill in the blank questions, hotspot questions. We used to have SATA questions and exhibit style questions. But nowadays, what they have done is they have changed and added some more things into the question. So we will talk about all these different types of items in my next video, because I didn't want it to make one video which is too long for the students to focus. And that's what we exactly do in our classroom, man. If like our brain cannot focus for more than an hour, or half an hour on a thing at a time, right? So now I want you to take a deep breath, relax, think about all the changes what I've talked about, write it down in your notebook, and then I'll see you guys in my next video, part 2, and I will go through every single type of this question with examples. So if you want to go grab yourself tea and coffee, put some caffeine in before you watch my part 2. I'm going to grab some water too. Okay. All right, guys. Thank you so much for watching part 1. If you felt like the information is, nice and you liked it, please make sure you guys subscribe to our channel and share this video with your friends. Because as I said, our mission and ambition is to help not just internationally educated nurses, but all the nurses worldwide who are aiming to write their NCLEX exam. All right, no more talking. Taryn will catch up with you guys in our second video, part 2.